Hi, it's Susanna with Science with Susanna, and today's video is about blood vessel structure and how capillary exchange works. Let's get started.
We'll begin with an overview of arteries and veins. Arteries can be defined as blood vessels that carry blood away from the heart. And you can always remember that because the A in arteries and A for away from the heart. There are two circuits that move away from the heart. The left side of the heart will send blood to the systemic circuit, which is going to go to all your organs. And then there's the smaller pulmonary circuit that just carries blood to and from your lungs. And on what I'm showing you right here, in general, we can be thinking about the systemic circuit. So veins then are going to be deoxygenated in the systemic circuit, and they're going to return blood to the heart. So to say that one more time, in the systemic circuit, arteries are oxygenated and veins are deoxygenated. Let's start over here on the left side. And what I'm doing is coloring in red a huge artery that you could think of this as the aorta, the biggest artery in your body. And when the blood is first pumped, it enters these large elastic arteries. These are the ones that are going to have the highest blood pressure, around 120 millimeters mercury at the start of the circuit. So these are notable for the high pressure that they have to withstand, and that's why they have so much elastic fiber in their walls so that they don't burst when the pressure comes through them. They're also able to expand and contract easily with each beat of your heart. So they get the blood flowing toward the organs. And then the next big arteries are called the muscular arteries. And the muscular arteries distribute the blood to the different organs. So for like the kidneys, you would have the renal artery. So this is going to distribute blood to the organs. They can constrict a little bit. And they might do this in order to limit flow to certain organs. So for example, when you are exercising, you're going to have a greater need for blood flow going to your muscles, right? And so your skeletal muscles, the muscular arteries within them, would be relaxed. And then the muscular arteries, like the renal artery going to a kidney, could constrict just a little bit to decrease blood flow through your kidneys while you're exercising, because at that point, cleaning your blood is not a priority. Okay, so then the blood vessels get smaller and smaller. These arteries get smaller and smaller until they're so small that we call them an arteriole, which just means little artery. Arterioles. They may be little, but they are mighty, because when these constrict, which they're very good at doing, they're going to have the greatest impact on systemic blood pressure. And therefore, tissue perfusion. Perfusion of tissue is how much blood is actually passing through an organ at any given time. You have to have a certain level of tissue perfusion or the cells start to die. Okay, so then the arterioles keep getting smaller and smaller until we arrive at capillaries. So the front end of a capillary would be dropping off its oxygen, and then the last half is picking up carbon dioxide. So for that reason, I like to make it both colors. And the blood pressure has dropped at this point down to about 35 millimeters of mercury. So you start at the beginning of the systemic circuit at about 120. And then by the time you're down to a capillary, you're about 35, and you're going to drop nearly to zero by the time you get back to the heart. I'm going to put the word capillary in both colors. So capillaries, and their job is exchange. So it's going to be exchanging nutrients, exchanging gases. They're very thin, so things can easily pass through them. They're designed for that. Then we come to the venules, which are just little veins that drain the organs of their deoxygenated blood. Get inside a box around the capillaries. So the venules might be somewhere around 15. So see how we just keep dropping? It's got to have just enough pressure to just barely make it back to the heart. So these drain the tissues. I purposely made this huge vein really big like this. These are large veins, are big and floppy and extremely low pressure. They might only have about 5 and literally can get maybe to 1 millimeter of mercury by the time they dump back into the right side of the heart. And so these would be called the big veins. And the biggest one is the vena cava. And they return the blood to the heart. And then that deoxygenated blood will get pumped into the pulmonary circuit, get its oxygen, come back to the left side of the heart, and then we start the systemic circuit over again. Something I'm adding into my videos now is an encouragement for you to test yourself after every kind of topic or concept that we cover. And so what I think you should do, and this is the latest learning studies support that as soon as you finish being introduced to some content, like I just gave you that content, then spend some time testing yourself over it, even if you're getting the answers wrong. So go ahead and go through these questions, answer them without looking at your notes, then go back and see how well you did, and then try it again. And this process, although it can be tiring and it's not easy, is the very best way for you to learn the material. Now that I've shown you how the blood flows through the systemic circuit, let's go ahead and look at the structure of these different kinds of blood vessels because they are different. Arteries and arterioles are designed to withstand high blood pressure. I'll show you is here on the left, right here. This is the wall of an artery, and this that I'm coloring in red is smooth muscle, and that's going to be particularly thick in an artery or an arteriole, and that's one of the things that makes them stand out. We call this layer the tunica media. Now look over here on this vein down on the bottom. Do you see how I'm coloring this in red over here? And it is much thinner. And then this little vessel in the middle right here does not even have any smooth muscle. It only consists of this soft lining, this soft smooth lining called the tunica intima. I'm going to put in green. So this is a capillary. And then look at the arteries, tunica intima, this inner lining. These are endothelial cells. If someone gets atherosclerosis, they start to have some dysfunction along these cells, and blockages can form. And the vein is also going to have the tunica intima. I'm making these in green. These are endothelial cells that are a type of epithelial that line the inside of all your blood vessels. They're simple squamous epithelium. The lumen, which would be here, and over here in a vein, we have a huge floppy lumen. The lumen is the inner space, and in this organ, that's where the blood is. In your GI tract, the lumen is where the food is. And in your trachea, the lumen is where the air is. I'm going to use a green pen for the tunica intima, so that's the one we colored in green. This literally means inner coat or coat innermost, like a tunic, right? So these are simple squamous epithelial cells. And it's also known as the endothelium. The tunic media, which is the middle coat, literally translates coat middle. And it's made up of smooth muscle. And in those big arteries, that smooth muscle is going to help it prevent it from exploding, a burst aneurysm where it ruptures. And then as you get to the more muscular arteries and then the arterioles, then the constriction in that by that smooth muscle can regulate blood flow. So the smooth muscle is important for vasoconstriction or vasodilation. Arteries and arterioles will constrict and dilate to regulate blood pressure and that also then is regulating tissue perfusion. So if the arterioles or the arteries constrict to the kidneys, then there is more blood in the other arteries, right? So pressure goes up in them and you can deliver more blood to other organs. It's like in your house, if you turned on every faucet at once, you might not have the pressure you need to wash your dishes, right? So in your body, by directing only certain areas to get blood flow and others to get less, you're able to make sure you always get enough blood pressure and enough blood perfusing or passing through the tissue in order to carry out the basic needs of that tissue. I'm switching to purple here to talk about the capillaries. And you see how thin they are, right? These little tiny ones, and they're microscopic. They are designed for exchange. Gases can pass through them, nutrients can pass through them, waste can enter them, and then veins, the third main kind of blood vessel, they are designed to drain organs. So they need to have very low pressure so that the fluid or the blood can easily pass into them, right? It doesn't want to resist. And we have another layer to put onto these blood vessels. The outer layer is called the tunica externa. This one we'll do in blue. And you can see right there, can't you, that it means the outer coat. And this is going to primarily be collagen fibers, so dense, irregular connective. I'm just going to put lots of collagen. Holds everything in place, supports it, keeps the blood vessel where it's supposed to be, and can also have roles in healing and things like that. Healing and scarring, I should say, too. The cells out here in this tunica externa start to act funny in disease states like atherosclerosis, start migrating around and going places they shouldn't go, building up plaque. So there it is on the artery. And then over here on the vein, you see where I'm coloring the vein. Let's go ahead and just outline some tunica externa. And there is connective tissue around the capillaries, but not formally called the tunica externa, so I'm not going to write that on there. I want to show you one more thing on this page that I want to emphasize the drop in pressure. So as you go from arteries to smaller and smaller arteries and arterioles and then to capillaries, pressure is going to just continuously drop. whereas it might be 120 in an artery. By the time you get to a capillary, it might only be 35, and then it's going to drop even more. And by the time you get to the very last vein, the vena cava, it might only be 1 to 2 millimeters of mercury. Because of that, veins have to have an additional structure, valves. Let's color the valves in orange. So these valves are necessary to prevent backflow. The pressure is so low in veins that it would just sit there and hole in your feet if it weren't for these valves. They have valves to prevent backflow. All right, that's good stuff. My new feature, the Test Yourself blood vessel structure, I have 12 questions here for you. You can pause the video, ask yourself all of these questions. I encourage you to write or type out your answers or say them out loud, or even record yourself answering each of these questions. Then go back and look at what you've drawn and see how many you got right, and then work the problem again, go through them again. This is the best way to learn, is to test yourself immediately upon listening to a section of my lecture. In between the capillary, which is the picture on top, and the cells of the organ, which are the tissue cells below, is what's called the interstitial space. So the interstitial space is between the capillary and the tissue cells. This is an example of a tissue cell. Let's say this is a cell in a muscle or a gland. Blood is delivered to that organ from arterioles, and then right as it enters the area that will be perfused, it passes through a little muscle called a precapillary sphincter. And then after that, there will be a whole bunch of capillaries. They actually call it a capillary bed. But we're going to put in purple this little muscle called the precapillary sphincter. So it gives a little bit of control to the organ itself to say, hey, I actually don't want any more blood, and it can tighten down. Or it can say, hey, we are dying in here. Send us more blood. So if it relaxes, then this tissue will become better perfused, assuming that blood flow coming through the arteriole is adequate, right? So the capillary bed might relax this, but if the blood pressure is low in the arteriole, and if the blood flow coming through the arteriole, though, is still not enough, it could be that it's still not going to get perfused enough. But the idea is that the precapillary sphincter can relax to increase tissue perfusion. So it gives it some local control. You can see the endothelial cells here. Just like we were looking at before, but in the previous page, it was a cross-section of a capillary. And here now I'm drawing the sagittal or longitudinal section so you can see it from the side. So there is going to be a pressure at the start of the capillary bed of about 35 millimeters of mercury. So we're going to call that hydrostatic pressure. Just think of this as like blood pressure, okay? Hydrostatic pressure is about 35 millimeters of mercury at the start of the capillary bed. And that is going to push outward, right? It's going to make fluid, not blood cells, but the fluid in those, flow into the tissue. And along with that, nutrients will hitch a ride. Now, meanwhile, there's also something called osmotic pressure within that front end of the capillary. But osmotic pressure never changes. It's going to stay at about 25 millimeters of mercury throughout the entire blood vessel, whereas hydrostatic pressure is going to go down. Now, osmotic pressure is caused by having salts and other solutes in the capillary, and particularly large proteins like albumin. That's the most important source of osmotic pressure. So what that does is it creates a pulling effect where notice I'm drawing this arrow smaller, but there's going to be some pulling of fluid in basically to dilute all of those proteins. So water will be able to enter. So we've got, notice though, more water and along with that nutrients and stuff leaving at the front end. But then you do have a tiny bit of water that's coming in at the front end. Now watch how the situation changes as the capillary exchange occurs and we get toward the end of the capillary bed. By the time we get to the end of the capillary bed, we're going to have a much lower hydrostatic pressure. So blood pressure is dropped down to about 15 millimeters of mercury. So we want to make a smaller arrow, right? We want to make it smaller than even that osmotic pressure one right there. So I'm going to try to make just a little arrow like this. Color that one in with blue. Okay, so you have very little water leaving at the end. You're going to have a net movement in because the osmotic pressure now, although it's still only 25 millimeters of mercury, is now officially more than the hydrostatic pressure. So the proteins that are in the blood, particularly albumin, are going to work to pull. Let's make this arrow a little bigger so you can tell. Pull water back in. If this system were to break down and you didn't have enough albumin or proteins in your blood, then too much fluid would remain in the tissues and your blood pressure would be too low to perfuse tissues. So we're going to have more water coming in at the end of the vessel. And I'd like to add on here, osmotic pressure is caused by proteins in the blood, particularly albumin, into the vessel. Hydrostatic pressure makes more sense to you intuitively. You get it that at pressure highs, it's going to push out water. It's a little weirder to think that you can have something called osmotic pressure that pulls water in, but that indeed is what it does. Local factors can influence this and change how much fluid can leave. Let me give you some examples. If you have a decrease in oxygen in the tissue, and it will dilate the precapillary sphincter for sure. Or conversely, if you have an elevation of carbon dioxide, which when carbon dioxide gets elevated also increases the amount of acid in the blood, and so you're going to have more hydrogen ions. All of these things are basically the capillary screaming for more blood and fluid to be coming in. And if you have an increase in lactate that is produced from anaerobic cellular respiration, where you're having to break down glucose into pyruvate and then lactic acid, now that is also going to cause the capillary to sense that it needs more blood flow. And if you have an increase in nitric oxide, which is a chemical that's made by endothelial cells, that can also relax the blood vessels. Once you get this fluid into the tissues, it doesn't stay there. In fact, it's eventually going to drain out the backside right here. It's going to drain out the backside into vessels that are called lymphatic vessels, and these are going to help drain excess fluid. These do not have blood in them. They just drain excess fluid, and they have a lot of white blood cells that they stop off at lymph nodes and have everything checked, right? Test yourself. Capillaries and tissue diffusion. Take a moment to pause the video and go through these 11 questions. Try to answer all of them without looking at your notes, then go back, look at your notes, and see how you did. Then try again. This repetitive practice is the foundation of learning. An important homeostatic imbalance that basically all of us are familiar with is swelling, right? The fancy word for that is edema. It's when we have too much fluid in the tissues. I'm going to add the word swelling here. On this page, I'll show you 4 reasons why you would have too much fluid here. That's going to be edema. I'm going to color this in yellow. And then let's take it away and see what would these reasons be. First of all, what if you have hypertension? What if you have increased hydrostatic pressure due to hypertension and it causes too much fluid to leave? Too much fluid out. So that's obvious. That's reason number 1. A second reason also is going to make perfect sense to you. You've probably swelled up because of inflammation at one time or another in your life. So that's the second reason, is when you have inflammation, and inflammatory chemicals cause the blood vessel to be too leaky. So inflammatory chemicals open big gaps between the endothelial cells, and you can have histamine that causes that. Also, prostaglandins can cause this. Those also nerve endings and can cause pain. So then we're going to have too much fluid being able to get out between the cells. Okay, so you can just have hypertension causing too much fluid to go out, or you can have inflammation causing too much fluid to go out in that particular area. Reason number 3 is if we just are blocking the fluid from getting out. So fluid gets blocked from draining. Then it's going to you'll have too much that's stuck there. It can't get out. This could be caused by a tumor that's blocking the drainage, or it could be from trauma from a surgery where lymphatic vessels were damaged during a surgery and fluid is unable to drain. Then I'll give you one more reason. So reason number 4 that someone might end up with too much fluid stuck in their interstitial space is when they have low plasma proteins. Remember I told you that plasma proteins like albumin are critical for maintaining high enough osmotic pressure. So the example I'll give you is albumin. You don't have enough fluid returning. So osmotic pressure is too low. So we have inadequate fluid returning to the end of the capillary. So in congestive heart failure, patients will develop edema because blood is backed up waiting to get into the heart. I can go into that a little bit in other videos, but think about edema. You've heard of pulmonary edema, so that's when the swelling's in the lungs. There can be edema in the abdomen, certainly swelling in people's ankles, all of these reasons. And then after surgery, edema can be a complication. And of course, we're familiar with edema, like if you get stung by a bee or you sprain your ankle, these are going to be local inflammatory chemicals. If someone goes into septic shock, they are actually having such massive inflammatory chemical reactions throughout their body that they're unable to maintain their blood pressure and their tissue perfusion tanks, and they can die from that. Test yourself, edema. Here are 7 questions that you can test yourself over after watching that last little bit of the video. Good luck. Remember to always check your answers and then try again. Try again until you're getting them all correct. So it's great for me to tell you, hey, the blood vessels have all kinds of ways to regulate how much blood is coming into a particular organ. It can change the precapillary sphincter, the muscular arteries leading up to it can constrict or dilate, and then the arterioles can constrict or dilate, and then there's chemicals that can affect it too. But not only that, but our body is also designed with different types of capillaries and different organs to fit their needs. So we'll start out this page with our usual coloring of the endothelial cells in green. This top capillary represents what's called a continuous capillary, and it's just a normal one. This is going to be the most common continuous capillaries. This is what like your skeletal muscles have and stuff. These are the most common. And we'll use blue to represent that you're going to have a normal amount of things that are able to leave by going between the endothelial cells, okay? Now the second kind, I love the name, they're called the fenestrated capillaries. Fenestrated. That word fenestra means window. And they got named this because their endothelial cells have holes in them. It's going to be a little tricky to draw or color. Let's see. I want to go around. See, if this is an endothelial cell, see how it has little holes in it? They're called pores. And each one of those, it's like a soaker hose, right? A regular hose, you just have stuff coming out at one end. But a soaker hose, you've got these extra holes. So they're leakier. And that's important in some organs. Some organs that would be bad. Like in your kidneys, that's exactly what you need. So in this case, you can have not only the normal fluid that leaves between, right? But also there's going to be fluid that can go out these little pores. See how that works? Let's go some out this way too. Hey, these are fun to draw. Ooh. Like that. So you can have extra leakiness. Okay, this is addicting. I don't want to stop. So we have these kinds of capillaries in our kidneys for filtration at something called the glomerulus. And then we also have them in our intestines. So they're better at absorbing nutrients. And also in the endocrine organs, so that they can secrete big hormones to fit them out there. Like big protein hormones. Now, if you thought that was impressive, next we come to the sinusoidal capillaries. And these have really big pores and big gaps between the endothelial cells. They're like a sieve. So if I put here, you can see here's the big pores and big gaps. See how the endothelial cells have real big holes and big gaps. So essentially then we can have movement of all kinds of things. Like that. So we're going to have lots of stuff coming and going. And this is important in the liver because the liver produces plasma proteins. We're also going to see this kind of capillary in the bone marrow because they're making red blood cells and putting those out into the blood vessels. Okay, test yourself, capillary types. I have 7 questions here over the different kinds of capillaries and see if you can answer all of these. When you get stuck, go back and look at the previous page of your notes and correct all your answers. Good luck with your studies, and I'll see you in the next video.